On the 8th and 9th of November 2025, I had the opportunity to work with the Czech Dental Hygienist Association. My goal was simple: explain why musculoskeletal pain is so common in dental professions, show what the research actually says, and teach practical strategies to protect their spine using posture, movement, and corrective exercises. We broke the workshop into 3 parts: science, strategy, and application. At the end, we collected data from each participant to help personalize future programs on the Good Back Academy platform. I started off by showing what the research clearly tells us. A large systematic review of 41 studies, nearly 18,000 dental professionals across dentists, hygienists, orthodontists, and students found that up to 97% have experienced some form of pain or musculoskeletal disorder. In the neck, the lower back, the pain rates were consistently high. The most commonly affected areas: neck at 58%, lower back at 56%, shoulders at 43%, wrists and hands at 36%. The upper and mid back over 40%. Pain is not only common, it is chronic and often affects multiple areas at once. One study reported that 42% had pain in 3 or more regions at the same time, showing how widespread the strain is, not just localized pain. What makes the pain worse? Studies found clear risk factors. Not taking breaks between patients increases the pain almost 7 times. Seeing more than 20 patients per day increases the chance of neck, shoulder, and back pain. Computer work, especially more than 6 hours per day, can increase the risk of low back pain and neck pain by up to 16 times. Women in dentistry consistently report more pain than men, particularly in the neck, the lower back, the wrist, and the mid-back. Static posture was reported as the #1 risk factor mentioned in almost 90% of the studies. Repetitive fine motor movements, especially the hands and wrists, are the second most reported driver of injury. Other contributors include poor equipment setup, high mental stress, visual strain, and muscular imbalance. Another study looked at 100 dental students and faculty. They worked around 32 hours a week. They sat 77% of the time. Treated around 46 patients per week. 80% reported pain in the last 6 months. The top pain locations? Neck at 58%, lower back at 52.7%, mid-back at 40.5%, and wrist at 27%. Most didn't use their chair's backrest. Almost half did nothing between patients to reset posture, and only 16% tried correcting posture, despite the pain. This is not about a lack of knowledge. It's about a lack of practical tools, realistic tools they can use during their workday. Why does it matter? Well, the body adapts to what it does most often. If most of your day is leaning forward, rotating slightly, applying the hand pressure, and keeping your neck still, eventually the body hardwires those patterns. That leads to asymmetries, muscle tension overload, joint compression, and tissue fatigue, and eventually pain. Hygienists are not just dealing with one kind of stress. They face 4: mechanical stress, such as postures, bending, leaning, reaching; neuromuscular stress, such as muscle tension, gripping, holding positions; visual stress, forward head posture, eye strain, magnification devices; and of course cognitive stress, time pressure, patient care, perfectionism, and emotional load. Pain is rarely just mechanical. It's multifactorial, and it starts long before symptoms appear. The triad: alignment, posture, and tone. This is our foundation. Alignment is how your body stacks when it is neutral and supported. Posture is how it positions during work and movement. Tone is about how muscular tone helps to hold appropriate positions in place. When these 3 are in balance, tissues handle load well. When they drift, stress builds up silently over time. The key supporting principles explained clearly. During the workshop, we didn't just talk posture. We taught how the body carries load. We focused on lever arms. Every centimeter forward means more weight for your neck, shoulders, and lower back to hold. Rooting, using the feet and ground to create stability up the chain. Kinetic linking, letting force move through the whole body, not just at one joint. Visual orientation, how the eyes control the head position and how the head influences everything below. Tone regulation, learning to release unnecessary tension instead of living in it. Exercise set, spinal hygiene, what we practiced. We used simple tools: a wall, a light band, and their own body weight. We trained movement hygiene, not clinic stretching routines. We focused on 3 types of drills: decompression drills, unloading compressed spinal segments with appropriate posture; tone resets, teaching the muscles to switch on and off instead of always staying on; and postural reinforcement, practicing how to stand, breathe, sit, hinge, and reach without pain. Not performed once a day, but scattered throughout the day like micro breaks, posture resets, and tension interrupts. Instead of traditional stretching, we focused on supported decompression, low tension active movement, and positional breathing. We worked on resetting tension in the neck, shoulder, ribs, and lower back, using opposite movement patterns after prolonged stillness. The goal is not more exercises, it's better movement habits, small resets, strategic posture changes, and using movement as recovery, not just after work, but while working. Because posture is not a position, it's a skill. At the end of the workshop, we collected anonymous data from 134 dental hygienists using a structured questionnaire. The purpose was clear: to understand their pain patterns, work habits, postural awareness, and interest in ongoing learning so that we can build a system tailored exactly to meet their real needs. Here's what we found. 95.5% were dental hygienists and 4.5% were in other dental fields. Experience ranged from 1 year of work to over 20 years, with 41.8% in early career, 1 to 5 years, 26.1% 10 to 20 years of work, and 11.2% over 20 years of experience. Pain and postural issues affect both new hygienists and experienced professionals, showing that this is not just a beginner's problem. 61% use magnification glasses. When asked how consciously they think about posture during work on a 1 to 10 scale, the average answer was 5.8, which means they know it matters. This is a key insight. Knowledge and awareness exist. Why did they think pain happens? When asked what caused their pain, they answered. 61.9% of our attendants identified static posture duration as an issue. 59.7% identified work posture itself as an issue. Emotional stress came in at 23.1%, a high number of clients at 26.9%, and low physical fitness at 16.4%. Their answers directly confirm what research has been saying for years. Static postures, awkward positioning, and mental stress are the primary drivers of tissue fatigue and pain. 64.2% reported chronic pain, not just temporary discomfort. Only 17.2% reported no pain. The average daily pain intensity was 3.55 out of 10. 55.2% of responders identified the lower back as a problem. 50% the neck, 41% the upper back, 25.4% the shoulders, 21.6% the hands, and 11.2% the hips. This pain map perfectly matches international research, and it confirms one thing. The spine is overloaded from both ends, from the head and from the pelvis. The neck, thoracic, lumbar. This is a full spinal fatigue pattern. The average physical activity of our participants was 2.7 sessions per week. The most common activities were walking at 70.9%, yoga and Pilates at 44.8%, resistance training at 44%, and physical therapy at 35%. They're active and general fitness helps, but it does not address posture asymmetry, tissue tension, or specific loading from dental work. Who already seeks help? 42.5% currently receive physical therapy or movement therapy, but only 11.2% work with a personal trainer. Therapy is often short-term. The average frequency is 1.5 sessions per month. That means that many are reacting to pain. This is where the results become very clear. 93.3% expressed interest in our online education program. 86.6% expressed interest in participation in future research. The belief that something useful was learned at the workshop was at 95.5%. The overall workshop rating was 9.55 average out of 10, and the structure was rated at 9.67 on average. This proves a powerful point. They don't just need information. They want a system that they can use in daily life. Now that we have international scientific data on dental occupational risks, real-world local data from 134 hygienists in the Czech Republic, proof of interest in practical and personalized education, a movement community ready to engage and contribute, this workshop wasn't the finish line. It was a launch pad. The next step is to turn these findings into profession-specific corrective programs delivered through the Good Back Academy, with modules designed around their pain regions, their work patterns, their posture habits, their stress triggers, their daily movement reality. This is more than training. It is the beginning of a research-driven, profession-specific movement for spinal resilience. We now have the data, we have the principles, and we have the tools. And we have a community ready to grow. I invite you to continue working with us to help build, test, and refine this system together. The more that we learn from real professionals like you, the more accurate and effective our health strategies become.